Okay, so welcome everyone. My name is John Catalano. I'm the director of the residential master's programs, both our MPH and our MHSA programs. I've been at Michigan just a few months now. I came from UNC Chapel Hill and Malloy University. And my areas of teaching are in health leadership, strategic planning, and healthcare finance. And I do research related to college and professional student mental health, and particularly look at depression, anxiety, and suicidality among students. I'll turn it over to my colleague, Charlita, to introduce herself.
Good afternoon. I'm Charlita Daniels. I'm the Associate Director for our Residential Master's MPH and MHSA programs. I also direct our undergraduate summer enrichment program in health equity and leadership. And I've been in the department for a number of years and work with the students and missions, this process, financial aid, curriculum management, and many other things. So I look forward to meeting you all.
All right, so what we're going to do is we're going to walk you through a few PowerPoint slides to give you an overview of the program, and then we can get to some questions and answers later. If you want to raise your hand during the presentation, please, by all means, do so. But usually best if we wait till we get to the end, and then we can open it up for open-ended questions and answers. So again, this will be an overview for you of the residential master's programs here at University of Michigan in the School of Public Health. We are in the Department of Health Management and Policy. And so we'll go over the program mission and the vision, our different HMP degrees, HMP meaning Health Management and Policy, our coursework, internship and professional development opportunities, and the program requirements, as well as the application process. So first and foremost, big picture, what is our mission? Well, we exist really to cultivate future leaders. You are the future leaders of the public health and healthcare industry. And so it's so important that you build a strong educational foundation in healthcare management, healthcare leadership, and public health leadership so that you're ready to go into industry or go into government agency or some other organization to practice your craft. Our approach is very comprehensive in nature. You have a core set of classes that you're going to take. I'll get into that in a few minutes. And you then have an opportunity to study different electives, not just in health management and policy, but also in other schools at the university. We are really focused on not just the business of health and public health, but also the human aspects of healthcare and public health. And so we take a population health view of the world in HMP, which is consistent with the School of Public Health and the focus of the School of Public Health. We're not teaching this in a school of business, we're teaching you in a school of public health. What is our vision? Well, we always strive to be the premier health leadership program in the world, not just the country, but in the world. And we have been recognized as being among the top programs. The ratings are a little bit arbitrary at times when you read them in US News and World Report, but at times, University of Michigan, we've been rated the #1 school of public health in the country. Right now, we're rated the #5 school of public health, the #2 school or #2 public school of public health in the country. So you are going to head to, if you gain admission here, one of the premier programs in the world for public health and healthcare management. And I also want to stress the importance of innovation in our curriculum. We are continually going through quality improvement process. And so when the curriculum for us is a living and breathing thing, and we are continually updating our curriculum and the course materials so that you are getting the most current information possible. We have an extremely strong alumni network that you can tap into. They also are advisory to us and help us to keep shaping that curriculum and reshaping it. Really, we view the program as a collection of learning opportunities. You will take, yes, a core set of classes. However, you will also be collecting these other learning opportunities really in your second years. And you do that through elective courses, possibly courses in other schools, as I already mentioned, across the university. Some students take classes in the School of Business, the Ross School of Business, others at the Gerald Ford School of Public Policy. And so there are plenty of learning opportunities, both within the School of Public Health and across the university. And our goal is your success. It's all about you. It's all about you getting to where you want to be professionally. And that's not just in the short term. We are not just worried about you getting a job when you finish the program. You become a member of the Michigan community from the day that you matriculate in our program. And our alumni are continually coming to us, getting involved, and we help them with their career progressions going forward. You have a lot of professors, faculty members, members of the staff who have done the jobs that you aspire to do, and that's what we help you to do. So how do we get there? Well, first of all, you are going to be full-time students. This is a 2-year full-time residential program. We discourage very strongly people who want to work full-time during their residential master's program. You really need to be 100% dedicated to the program. Some students will take a part-time job here and there, but for the most part, this is your full-time effort. If you can't do that, if you cannot commit to a full-time residential program, we have an exceptional executive master's program that you can think about. And you take classes fully online. There are some residency requirements as part of the executive master's, but for the residential program, you are here as a full-time student. Our classes are in fall and winter terms. They're not in the spring. We have a late spring semester, but you would not be taking classes in the spring and certainly not in the summer because you're going to be doing your internships. And everyone in the summer between your first and second years, everybody does an internship. It's not just a requirement of the program, it's a vital learning opportunity for you to do an internship. And our interns are all over the country, and I'll get to that in a few minutes. So we kind of view residential master's programs as one program, but you have 2 degree options, and it depends on what your end goals are in choosing which degree program. We're happy to talk to you about which degree program you should choose. You do need to choose, though, and the importance of choosing is really critical, because The Masters of Public Health students, the MPH students, enter a 12-credit, 2-semester first-year program of study that is set, and it gives you exposure to all disciplines within the public health sphere. The Masters of Health Services Administration program also has a set of required classes, albeit not in a core competency program. We have those classes identified within your curriculum model. And so that selection really has to take place before you apply and before you would matriculate into the program. And so public health, you're dealing in the policy world. You may be working for a government agency. You may be doing enforcement, possibly working in a local health clinic, community-based health education program. There are so many opportunities. Some people go to work for the CDC, the Centers for Disease Control, or the National Institutes of Health after finishing an MPH. And then the MHSA is primarily focused on the business of healthcare delivery. And so many of our MHSA students end up going into hospital administration, consulting, other kinds of healthcare delivery service business positions. It's not to say if you get an MPH that you can't do that as well. Many of our MPH graduates do go in that direction, and you will learn a lot of the same things that our MHSA students learn. So again, which degree is based on your long-term career goals? Do you want to be in the policy and advocacy and government space? I would say MPH. If you know that you want to be a healthcare executive in the future, possibly work in the C-suite of a healthcare delivery organization, then you want to go MHSA. And again, Charlita and I are available to talk to you as you're putting together your application. So this is just kind of the progression. So your coursework plus your professional development, which includes joining professional organizations. You can join the American College of Healthcare Executives, the American Public Health Association, if you're focused on MPH. There are so many other opportunities to join professional organizations, and there are student rate opportunities available so that you're not paying the dues that a full member would have to pay while you're a student. You're also going to engage in professional development while you're in the program. We spend a lot of time working with you to develop all of your networking skills and learning how to look for those jobs when you're first out there. And again, our goal is your success. And so this all adds up to career success, which is mostly why you're doing a master's program. So our goal in our coursework is to provide what we call competency-based graduate education. We are fully accredited by the Commission on the Accreditation of Healthcare Education Programs, and as well as the CEF, as well as having CEF accreditation, which is the accrediting body for schools of public health. And so you are coming to a fully accredited program. We also hold a membership in American University programs for health administration. That's the OFA organization. And many of us are members of the American College of Healthcare Executives, and you have an opportunity to join ACHE as a student member and participate in events. It's all competency-based training. Again, we have competencies that we want you to leave the program with, And so when you look at a syllabus at Michigan, you will see when you take your coursework that you're going to have competencies that are tied to all the learning objectives for that class. Bottom line is that you're going to leave here with all the competencies that you need for professional success. We are a community of lifelong learners, and we encourage that for all of our students and alumni as well. Healthcare is kind of like that. You need to be a lifelong learner. So always remember that your education does not end when you walk across the stage, you get hooded, and you pick up your diploma. Your education will continue throughout your professional careers. Just gives you an idea of the required courses, 45 credits of required courses out of 60 total. And so when you're dealing with your required courses, you're going to take foundation of health systems, health policy, data analysis. We do have a quantitative component to our program. And so you don't need to be a math wonk to be able to excel in our program. Just be prepared to take quantitative classes and apply yourself in that coursework. Population health and statistics, organizational theory and management, health economics, cost effectiveness and analysis, financial accounting, so that you have the foundation to lead and manage in the future. And then a host of elective courses. These are just examples of some of our electives that you can take in your second year: public health law, health insurance, leadership and strategy, and so on. And so, you know, we are staying very current. As you can see, we have an AI course, and we're continuing to build out not just our institutional AI capability, but we're actually bringing AI into the classroom and using it not just as a teaching tool, but teaching you how to apply AI to your work in the field. And so I've mentioned professional development a couple of times now. We have a class that you're going to take. Every first year student takes a class, HMP, Health Management and Policy 620. It is taught by Catherine Kalali, who is an exceptional professor here at University of Michigan. And she brings in a number of alumni. You will have current students who will speak with you. You will have faculty members who come and speak with you. I will come in and speak with you. There are a number of people who will come into that class and who you will see in that class. And Kathy helps you with basic networking. If you're not comfortable with networking yet, you will be comfortable networking by the time you're finished with the program. I guarantee that. And then we have so many student organizations that you can get involved in. And if there's an interest, there is an organization for that interest. And if there isn't an interest that you have that we don't represent, you can come to Charlita or I, and we will talk to you about possibly starting a new organization if that's warranted. And I can't stress enough how wonderful these case competitions are. You have an opportunity to try out you kind of do a demo case presentation or a presentation, and we send students around the country to compete at these large national case competitions, some of them run by other universities. We have run case competitions at Michigan ourselves. We work with the Michigan or the Midwest chapter of the American College of Healthcare Executives and other universities, Ohio State, UCLA, Cornell University, a number of organizations, and and universities run case competitions. So you've got a tremendous opportunity to get involved in case competitions, and they're great opportunities also to network. So I mentioned internships. Internships are required. Excuse me. So your internship is required, and it's a 10 to 12 week summer experience. We have an internship and fellowship coordinator who works very closely with every student on an individual basis to find the right fit internship. And again, you are all over the country. There are interns who intern on the East Coast in New York, Boston, Atlanta, on the West Coast in LA, San Francisco, San Diego, and everywhere in between. The bulk of our interns end up in the Midwest. And we have a lot of internship opportunities at Michigan Medicine, but we also have internships at Cleveland Clinic and the Mayo Clinic and other Midwest places. So you really have a chance to be anywhere in the country that you may want to be. We want to find the right fit for you for your internship. There's department and school level support to identify and obtain your internship, as I already mentioned, and we really we encourage you to talk to the second year students after you matriculate to talk about their internship experiences. So what kinds of organizations do our interns work at? Well, it runs the gamut of organizations involved in public health policy and healthcare management. So information tech, being an analyst, hospitals and health systems naturally being a very popular internship option. Many, even more people, as we see a trend, are looking at consulting and venture capital. The numbers for venture capital and private equity have been growing. A lot of people get to do internships in those disciplines, government agencies, policy institutes, pharmaceutical industry, you name it, we've had people do internships in that sector of the industry. Really important for you to know that we are here to develop you into future leaders. So I was a healthcare executive for almost 40 years before I entered full-time academia. And my generation, I think we did a good job, but we failed in many areas. We are training you to take the reins and lead the healthcare industry, lead public health initiatives forward to make fundamental foundational changes that are going to have lasting positive impacts on the public's health. And you can do that in whatever way you want, but you will build all of the leadership, all of the technical skills needed to be the future leaders of the healthcare system and the not-for-profit and government public health organizations. Just to give you an idea of our success with post-graduation rates, 100% of our graduates have secured either a fellowship, that's now around 40% who are going into fellowships. Fellowships are usually 2-year experiences, sometimes in a hospital or health system, sometimes in policy institutes. There are a lot of different fellowship opportunities. There are some international fellowship opportunities that our graduates go into. but they go into hospitals and health systems, of course, again. Venture capital, you can see even more people are headed there, not than even in the internship numbers. And it's the same categories. This is just where recent grads end up. And then you have your alumni network. And so your alumni network, I'll show you that slide in a moment, but just understand, if you look on the left on this slide, you'll see the basic breakdown of what people are doing. So just under 5% go on to earn an advanced degree and a professional degree. Some go to law school. We have a dual degree program with the School of Law. Some go to medical school. Some who are in the program are medical students who do a dual degree MD, MPH program. And so you may be in class with physicians, and many people do their MPH or their MHSA before they enter a professional degree program like law school, medical school, dental school, whatever it may be. And so here's where your alumni network is. We are in the C-suite. We have people, so 21% are currently C-suite executives in the health sector, and another almost 30% of our alumni are in management roles. Now, because we count all of our alumni over many, many years, we have a lot of younger alumni who are currently in that management bucket who will ultimately be in that executive C-suite category where we have 21% of people. And so that's where we like to see you end up. If you are MHSA in particular, if you're MPH, being an administrative staff member, some people go into education, being an analyst, consultant, a lot of people end up in consulting. We want to see you go there as well, but we want to see you having a significant impact on the health of populations and the health of the people who you serve. You got over 4,000 alumni just from health management and policy. And then we have tens of thousands of alumni around the world who you can tap into. They are, and our HMP alumni are across the United States as well as working internationally. So if you have an interest, our alumni are very generous with their time. You reach out to us, you reach out to Catherine Kalali, who deals primarily with the alumni through our Griffith Leadership Center, and we can connect you with alumni who can help you in your careers and answer questions you may have about their careers and why they chose to do what they do. So what are we looking for? We want to see, obviously, people who are aligned with our mission. Not just to be a health executive or policy person, but someone who genuinely cares and aligns with our long-term mission. Passion and enthusiasm for public health. Even if you want to be a hospital CEO one day, which is what I wanted to do until I realized that the healthcare industry had changed. And so if that's the route you want to go, then you can get there. You can certainly get there. That's without a doubt. But you still, as a hospital CEO or a hospital executive, have a public health mindset. You are looking out for the communities that your hospital serves. There's obviously a strong academic background. This is the University of Michigan, and so we do have significant academic standards, engagement in service to the greater good when you were an undergraduate student, and postgrad if you are postgrad and you've been doing something for the last year or a few years. A commitment to addressing the issues around health disparities. We're very focused on equitable access to healthcare issues, and that applies in the healthcare delivery sector as well as in the public health sector. Someone who has leadership potential, maybe has held some leadership roles or one leadership role in the past, or speaks about their skill set and their mindset and how that makes them a potential future leader. You stay current and up to date with what's going on in healthcare and public health. Interest in quantitative work, I mentioned it earlier. We have it here for a reason. You don't have to, we're not going to teach you to be a chief financial officer of a hospital. Okay, that's not why you come to the University of Michigan. But you will know how to read financial statements. You will know, sitting around a conference table, what questions to ask. And you'll know how to do financial analysis so that you can either ask the right questions or, when your early career, do those analyses yourself. And the same goes for economics and other quantitative classes that you're going to take. We want people who are proponents of teamwork and collaboration. We are not a competitive institution from a culture standpoint. If you are ultra competitive, you will do well here, but understand that you're walking into a collaborative environment. Our students work together toward a common end. They do not work cross purposes, and you'll find the same with the faculty. And it's a diverse set of interests within healthcare administration and policy. We are looking for diversity of interest. We don't want cookie cutter programs. We want people who are going into all those fields that you saw earlier in the presentation. And so the application process is very straightforward. We are on the SOFOS application platform. If you have not yet started your SOFOS application, you should create an account, open up your SOFOS application, and choose the programs that you want to apply to, and then complete your application. The deadline, or the priority deadline, is December 1st, so a month and a half from now is our priority deadline. And then the final deadline is May 15th for a full 2025 matriculation. Between getting a letter of acceptance and matriculating, there is a lot that happens. We have admitted student discussions. We have discussions about your first year curriculum and coursework selections and things like that. So there are a lot of moving parts, but most important for you is to complete and submit your SOFOS application. And then the admissions committee is about to start meeting. Beginning of November is when we are going to begin our meetings. And as we work through applications, we will send out offers for interviews to those who we deem should warrant an interview with us. That interview takes about 20 to 30 minutes. It's with a faculty member or a key member of the staff, and so we answer your questions as well as ask you a series of questions. All interviews are virtual, so you're not going to have to travel to University of Michigan, although if you want to come and visit sometime, let us know if you're going to be on campus, and we'll at least be able to greet you. But your interview will be virtual. And then we have a big Admitted Students Day in March, and we invite you to come here for the Admitted Students Day. We also have virtual opportunities to engage as admitted students if you can't get to Ann Arbor. There are some tuition scholarships. They do not require you to file a separate application. We consider every applicant for scholarship money. And all applicants are considered at the time of admission. So we make those decisions very early on when we decide if we're going to admit you or not. We offered scholarships this past year, really, I guess, Charlita, the last couple of years, would you say, to 60% of our students. So you have it right there, fall 23 and fall 24. So it has been the last couple of years that we've offered approximately 60% of our students scholarships. Just to give you an idea of the stats, we get around 300, 350 applications. It depends on the year. Some years we've gotten as many as 400 applications. It really is very cyclical. The COVID-19 pandemic, there was a spike in applications that we call the Fauci effect. A lot of people saw Dr. Anthony Fauci as a prominent person in public health, and there was a surge in interest in public health. We interview about 180, and that's a really big step. If you get an interview, that is very, very telling. And that is because we accept about 150 applicants from those that we interview. So it's a high percentage chance of getting an offer of admission. And so for this year, we had 52 new students. We had more in the summer, but a few people had to defer or not pursue their degree for personal and financial reasons. And so some will be starting in fall of 25, and some just had a change of fortune and could not start. But our goal is for everybody who is admitted to come to Michigan. And then if you want to look us up, we do try and stay active on social media. I'm not going to say that you'll ever see me in a Twitter or Instagram or certainly not a TikTok video, but we are active on social media. You can certainly look up our accounts, and if you want, follow us, and you'll see all the different things that are happening at University of Michigan Department of Health Management and Policy. So I want to thank everyone for sitting through my droning discussion. I know my wife likes to tell me that after about 15 minutes, she's tired of hearing me talk. So I will now open it up to questions for Charlita and myself, for anyone who's got questions. So we have some in the chat. So in terms of rolling admissions, it's not really rolling admissions, but as we interview people, the committee continually meets. And so there may be admissions decisions made at that time that the committee meets based on interviewer feedback and the admission committee's full review of your application. It is a holistic review of your application. Every application is read. We consider every aspect of your application. This is not just about numbers. We are, as I mentioned at the outset, we're looking for fit. And so it's not truly rolling in the sense of what rolling admissions is, but but after, and Charlita even put that answer in, and thank you, Charlita, that it is rolling after our December 1st priority deadline. What's the average GPA of applicants to the program? I don't have those data. Charlita, do you have any sense of average GPA?
It was 3.4 for this year. So I put that in the chat as well.
Thank you.
And so the other questions, we absolutely accept international students. We have international students every year in our program. The program is full-time residential. So all international students are present here, and you have to go through the visa process after you are admitted. And our admissions office is fantastic working with international students, the visa process through our international center. So that information would be provided to you. There's also information in the admissions part of the School of Public Health website that is specific to international admissions you might want to take a look at. And also, someone asked about the internship. All students are required to complete an internship. So it's for any student that's in the residential master's program, no matter if you're a domestic or international student.
Okay, and Charlita also posted the link for the international students admissions information in the chat. So if you are international, just copy that link and you can research that further. There's another question. Does the program accept students straight from undergraduate? We do accept students directly from undergraduate programs. Students come to us at all points in their life. Some are very early, right out of their college education. Some come after a few years, some after 10 or 20 years of professional experience. So it's really a matter of when the right time is for you to pursue your master's degree. The master's, particularly in healthcare administration and hospitals, health systems, it's really the ticket to entry to those positions, at least department head level and up positions. And so when you're ready to get to that point in your career, that's the time to do it. And we've seen more and more people coming direct from undergraduate, because once you start your career, it can be very difficult to take 2 years off and do a residential program. So we want to see people who have the time and the energy and the ability to devote those 2 full years of residential time. And the answer to your question about, I don't know if Charlita, did you answer the question about international students who are doing online?
No, I haven't seen that one yet. Foreign students studying online in their home countries. Oh, yes, you are required. This program requires you to be here on campus. So this is not an online program. So you would have to do an internship.
Now, if you want to study from your home country, then take a look at the University of Michigan Health Management and Policy Executive Master's Program. That is an MHSA program. It's a Master's of Health Services Administration program. It's very similar, almost identical to the residential program. You don't get all of the on-campus experiences that you get in the residential program, but if you want to study from your home country, then you can consider the Executive Master's Program. And Charlita, you answered about the class times. Unless Charlita is angry at me for some reason, I will usually not be teaching up until 8 p.m. But I will know if she's angry, if she schedules me for a 6 to 8 p.m. class. I know I will have done something wrong.
So to clarify on that, most classes are 8:30 to about 5 p.m. Monday through Friday. For example, this fall classes are in those times Monday through Thursday. There are some classes, if you're looking at electives, that are outside of the department that are taught in the evening, so in the 6 to 9 p.m. time frame. So that's why it's kind of the full day. You can expect classes Monday through Thursday for the most part. If a class is on Friday, it's typically in the morning. So between 9 and noon on any Friday.
Okay, I see we have a hand up. Jesus.
Hello, can you hear me?
Yes.
Okay, fine. Thank you for giving me the opportunity to ask this question. Anyway, my name is Dio Kilo. Yeah, and I'm actually calling from the UK. Tentatively, I'm open to apply for the role, but I'm actually thinking of applying for a PhD. But um, based on the fact that I'm international and considering the STEM, because when I attended one of your programs earlier, I was told that the MPH is considered as STEM. The MPH is considered as STEM, not the PhD health services, health policy and management, health policy management. That's one I'm actually looking at. So tentatively, I do have a master's degree in health services management. And my background in my bachelor's degree, it's more of it's more of medical lab science. It's called medically based. So my question right here is that coming in as international students, I've actually dropped that thing. Is it a full scholarship, or is it a full scholarship, or is just about a support scholarship, fully funded, or is support scholarship for international, where you still have to make payments, or you don't have to make any payment at all, in case you. So that's my first question. So my second question uh, will be if it's actually considered as STEM. That's my second question. Thank you.
Thank you. I can answer that for you. So our MPH and HMP and the MHSA and HMP are not considered STEM degrees for the purpose that you are mentioning. We don't have a STEM designation for our degrees. And with funding, we are tuition support only. So there are costs associated with the program. So your fees, there's housing and other costs around being in Ann Arbor, and you would need to cover those as well.
Okay, thank you so much then.
You're welcome.
But also, if you already have a master's degree, you could speak with our HSOP program director and the support staff in HSOP about applying directly to our PhD program.
Yeah, I'll be glad to do so, because actually that's exactly what I wanted. But because of this time, considering as international students and who is not based in the US, but I'm actually based in the UK. So it's something, because you have to look at the visa policies and things like that, where it considers more of the STEM policies, more considering STEM services compared to administrative services. But basically, I rather want to do a PhD because I already have a master's in health services management already, which I understand majority of what has been explained. But the area I actually want to explore the more is pharmaceutical and biotechnology, majorly, and healthcare service delivery. So those are the areas I'm actually concentrating on, majorly. So I won't mind if there's an opportunity that can that can actually facilitate that, because the conversation that you proposed, I don't mind.
Okay.
I will put the link for our doctoral program in the chat for you. For those of you who are interested in the doctoral program, they are best to answer questions about eligibility for that program. So here you are. So, and it's called the Health Services Operations Program, or SHOP. And there is the link for everyone who's interested.
And so, and it's an exceptional program. Faculty meet with students in the program on a weekly basis. It's a presentation-based forum, and we have people doing international research as well as domestic research. And it's a very, very engaged and very dynamic group of people in the PhD program. But back to master's degree programs. Any other questions about our master's programs, or is there a question in the chat that Charlita is she is a rock star in answering all these questions? Did we miss anything? I'm more likely to miss things than Charlita.
Jessica.
Yeah. You guys have mentioned a couple of times the executive master's program, and I was wondering two things about it. One, I wanted to clarify, so it's an MHSA. If I'm interested in the MPH, that would not be the route to go compared to really like residential is what I would want.
Right. If you want to work in the public health sector, in policy, in advocacy, possibly work for the CDC. Do we have a future applicant in the room there with you?
Yeah, right. He wants to apply.
Okay. So
this is my son.
So you're just going to have to wait about 18 years and then we'll accept your application.
It says you have to wait 18 years and then you can come to school with me and go together. Yeah.
So yes, if that's your goal, then it would be the residential program.
Okay. Okay, cool. Then my other question doesn't matter because I was going to ask about the price difference, but I don't think I'm interested in that one. So
they're both 60 credit programs, and so it's the same.
Oh,
the
really?
exec master's program is
executive.
Less.
I thought you meant MPH versus MHSA.
Yeah, online versus residential. Online would be cheaper.
The online program, he has 36 credits or 40 credits, something like that. So it's a little bit different in the tuition cost because you're in school, a little bit a different schedule. But I can link the registrar office. You can look at what the tuition differences are. It does. They do charge out of state or in state tuition. So take a look at that. I'll put that in here for you.
Thank you.
And if you're interested, our program director for the executive master's program would be happy to speak with you.
Cool. Thank you. For the internships, you mentioned that they were like all over the place, but would there be any guarantee or likelihood that I could have one local if we were going to relocate the family to be local to the school? I wouldn't want to be off in the summertime. So would there be a high likelihood that I could find something there?
Yeah, very high likelihood. About 53%, 56% of our student interns do their internship in the Midwest. Michigan Medicine has a lot of internship opportunities, and so a lot of people end up there.
Okay, cool. That's it for me.
Yeah.
We are coming up on time. It's nearly 4:30. So if you have any last minute questions. I think we covered everything.
I do have one. That would be, so I saw there was like a Juris Doctor with an MHSA. How would that work?
So the dual degree programs work where you would apply to the law school and you would apply to our program. So through the two different application services, the admissions decisions are separate. So we don't coordinate admissions decisions. If you're admitted to both, you can elect to be a dual degree student And those are called MDDP programs. So it's just a Michigan dual degree program. And our students, you decide if you're going to start in public health or in law. And instead of 5 years, you do the program in 4 years. And it depends on where you start. You do 2 years in law first, and then come here for 1 year, and then do a combination, or you do 1 year in public health and 2 years at law, and then come back in the 3rd and 4th year in a combination.
Okay, thank you.
You're welcome.
Okay, is there anything else? You can contact us, you can contact the registrar, go through the website, look at all the information. There is a wealth of information on our website. And most importantly is getting your SOFOS application set up if you haven't already done so, and getting that completed and submitted. Remember, you've got 6 weeks or so until, well, actually less than 6 weeks now, until the priority deadline of December 1st.
Thank you, everyone.
All right, thank you so much. Have a wonderful rest of your day.